So I'll turn things over to Dr. MacKenna.
All right, thank you so much for that introduction, and it really is an honor to be here with my classmates who are also brilliant in their own ways. So, but I'll get to it because I know it's Friday afternoon, and at least the New Orleans folks are not in Grand Round. So, as we've said, I'm an integrative psychiatrist, and I'm focused on what I consider to be the next wave that we are anticipating after this pandemic has started to subside. So just some basics. When I was looking at this, I couldn't remember when this pandemic actually started, because at least for me in this time of physical isolation, time seems to have gone in a different direction. So I thought it was interesting to kind of remind ourselves that it's been this long. And that we've had that first case come to Washington State back in January, the first of unknown origin in February, which is significant for those of us in New Orleans because we realized in hindsight that our surge started with Mardi Gras, which was just a few days before that first unknown case. And then as of last night, those are the numbers for the total number of cases. And we all know that we have more than that because this is based on who can be tested. So over 1 million plus, and deaths, unfortunately, over 70,000. So the second wave that those of us who are in disaster psychiatry and any type of mental health care are anticipating based on other pandemics and other disasters is that mental health surge. So what tends to happen is that folks go through whatever type of emergency or challenge that they're dealing with, and are very good at compartmentalizing and putting their emotions up on the shelf so they can deal with the task at hand. We see this especially with our first responders, but really this is affecting the entire world, as we know. And so your average mother in Iowa who's homeschooling for the first time is also not dealing with her emotions because she's dealing with teaching her 7-year-old while the 3-year-old's having a tantrum. So for that period of time, folks are just doing the best they can. Once people feel like they can breathe, then we see other things happening. So China, as I mentioned, is where things first started. They've done a number of different surveys throughout their country. They screened over 1,200 people from 194 countries, found that over 50% reported moderate to severe psychological impact from experiencing their pandemic. A reminder, most of that country was inside for 20 to 24 hours a day. Because that was how they basically got rid of what was happening. Depression of moderate to severe levels was 16.5%, and then anxiety, understandably, 28.8% in China with the folks that they surveyed. From both China and Italy, and also from our experiences with previous pandemics, we know that there are certain populations that we have to consider when we're thinking about what's going to happen with the after effects and that mental health surge. Those who have been isolated in any type of way are obviously at higher risk, especially those who've been exposed to COVID or who have had a positive test. As we know, those who are hospitalized are isolated completely. Anyone who comes into the room, it looks like they're a spaceman. No one's giving them a hug. No one's holding their hand. I can only imagine how devastating and lonely that feels. And then there's those of us who maybe have high-risk pre-existing conditions, who are kind of living in a place of anxiety, maybe even during flu season normally. Folks with things like asthma, COPD, heart conditions are already a little anxious, and then when you add something where they're hearing story after story of people, being intubated, maybe not being extubated, there's a lot of anxiety and concern going on with that. Then, of course, those who are bereaved due to any type of loss, whether it be an actual loss of life, which the Kaiser Family Foundation has found about 9% of those in the United States have experienced an actual loss in their family or loved ones due to COVID, or that of their livelihood, which Kaiser also found about 84% of folks are now reporting that their lives have somehow been disrupted by this pandemic, most of which are probably financial from what we are seeing. And so that also puts them at higher risk for some type of mental health illness or response. And then those, of course, with previous diagnoses. They're already at a higher risk, and then because of how we've had to respond to this with the physical isolation and what have you, they may not feel as connected to their caregivers. Perhaps they're isolated from folks who are usually offering support. Because we're keeping people out of hospitals, maybe they haven't seen their therapist or psychiatrist or primary care doctor, whomever is their point person for a number of months. And so that alone is going to put them at higher risk. And then, of course, there's the population that I've been working with closely and that I know a number of my classmates have also been working with, are healthcare workers. Because of the nature of our jobs, we're already at higher risk for mental health effects, whether it be burnout or, unfortunately, suicide. Being a physician, if you look at occupations and the risk of occupations for suicide, within women, being a physician is the 6th leading cause for suicide, and for men, it's the 8th leading cause. And that's without a pandemic going on. So then you add what's happening and all that's coming at them, that is amplified in ways that we haven't completely begun to understand. There's, obviously that risk every day that especially our frontline staff is undergoing of being exposed. The shortages of personal protective equipment. I've been told by firefighters and others that they are given PPEs and the PPE that's given to them expired in 2010 and they need it to last for more than a week. So even when they have equipment, it may not be the equipment that they know they need. Then adding to that the longer hours, the lack of sleep, and then the fear of infecting their families. A number of folks who are on the front lines are isolating themselves from their families because of the nature of this disease and the nature of the treatment they're providing. They're also isolated from their normal support system, whether that be obviously their families, but also their coworkers. Gone are the times of being in the lounge and being able to unload to the person that is your person at work. Like, we all have a person. And when you can't see your person, it's really hard, or you can't give your person a hug, that's really difficult. Or you can't stand within 6 feet, that's hard. And then, of course, there's the moral injury, which is something that we don't like to talk about, but needs to be spoken about, where these folks are, because of, again, of the nature of what's happening, being put in positions where they may have to decide who gets what resource, or watch their patients in experiences that are devastating, such as dying alone. And because of the need to protect themselves for their families at home, they aren't able to do what they would naturally want to do as healthcare providers, which is hold their hand, be there present for them in a physical way to really show what their emotions are feeling. And that's not what most of us signed on for. I feel like I need to point out that as far as the fear of infecting others, there's also that fear of infecting themselves. It's been found, again, from Kaiser, that 39% of healthcare workers actually either have a condition themselves that puts them at higher risk if they were infected, or have a loved one at home. So that's something that isn't an irrational fear. It's something that's very true and does affect what's happening with them every day. So again, looking at China, as I mentioned, they've done a number of surveys, mostly online. So they surveyed in multiple sites, multiple hospitals, medical staff that has been quarantined and isolated, over 1,500, and using some standard scales that most people are familiar with, they found that depression was in over 50% of those folks. Anxiety, 44.7%. Insomnia, not surprising from what people are reporting on the field, 36.1%. And then of stress, of course, over 70%. So this isn't surprising, but it is something that we're going to have to deal with. It doesn't just magically go away once this pandemic has been put under control. So all that sounds all pretty hopeless. Moving towards a place of growth, the difference between what we see and call acute stress, or what looks exactly like acute stress but is just called the DSM post-traumatic stress, and what we would like to be at, which is a place of post-traumatic growth, is as an individual being able to be present in the moment, be able to process what is happening to you in real time, being able to digest what's happening to you in real time, not to be compartmentalizing it and putting it on a shelf and not dealing with it, pretending it's not there. And the only way for that to truly happen, for healthcare workers or people in society to be able to practice the mindfulness that we've been able to do today, and practice yoga or things that are going to help them be mindful and move towards a place of growth, is for them to feel safe. You know, Hani said it during our meditation, that when we were thinking of moving into a place that was more comfortable, safety was a word he said more than once. To feel safe, people need to feel supported, both before something like what's happening now happens, during, and then after. So there's a number of ways for that to happen, not least of which is ongoing communication. And that communication really needs to be honest. Honest to the point of, if there's an unknown, saying that there's an unknown. We've seen examples of this happening in different areas of the world and country, and this not happening, and how people have responded to that. People tend to have a better response, even if it is an unknown, when the person in charge admits that it is. And then, of course, having routine, ongoing support. In China, they had this through social media. They actually offered through their equivalent of Facebook, they offered CBT for depression, anxiety, and insomnia. They also had artificial intelligence present that kind of dinged a post or an interaction that was questionable for suicide, and then mental health volunteers would be involved and be able to intervene at that point and help folks stay psychologically safe. The folks in Italy, who also had a large surge and at one point were second to China in the number of cases, also stated how important having that ongoing support is. And both they and China, and also here in the US, have been doing that virtually, whether through the social media. We've probably seen a number of things being posted here in America on social media, but also through telemedicine, which a number of us in mental health are now doing, and folks in other types of medicine as well who aren't on the front lines are doing. And all of those people can be offering some psychological support to people that they're reaching out to. And then it's really important when interacting with someone who's dealing with this type of challenge to allow them time to reflect and to talk about what's happened, and to really have meaningful conversation, mainly to allow for the narrative to change from one of trauma to one that is more meaningful and allows for that movement towards post-traumatic growth, where there can be, I a time to find what maybe what they've learned from the experience, what the country's learned, what the world has learned. I think Kitty did a great job talking about that at the start of the talk, as far as ways that we can take what's going on and move towards a place of growth as a community, a society, a world. And that really does help people get to a place of healing when dealing with this mental health surge that's happening along with this pandemic. So as far as the outreach and support, I felt as a psychiatrist, I have to highlight things like the suicide prevention Lifeline. It does a really good job of not only connecting to folks who have thoughts of suicide, but also people who are just in a time of stress and don't know what to do, family members of loved ones that are worried about their mental health state. They're able to connect with local resources and get people to a place not only safe in the moment, but ongoing support, which is incredibly important in this time. And then SAMHSA has the disaster distress helpline, which also offers mental health support, as well as more specific support towards whatever disaster is happening, which at this moment is the pandemic, to allow for folks maybe with financial distress to connect with what is available as far as loans and unemployment and what have you. And then there's always local offerings that, depending on where you're located, a number of the universities have started offering either hotlines or clinics to folks to be able to come for free or sliding scale to offer that ongoing support. And then we have some amazing female psychiatrists who opened what's known as the Physician Support Line. This line is run entirely by volunteer physicians. It is meant for physicians only because it is meant to be a peer-to-peer experience. They found that physicians tend to be wary of exposing themselves due to stigma of mental health. So they wanted to create that safe space, which is why it is for physicians, and it's staffed by physicians. So they have over 600 volunteers. I know they were using 600 and then have a wait list of I don't know how many. I think there are some physicians who are actually on this talk who are volunteers and are amazing. And so they've been able to expand the hours from 8 in the morning to 3 in the morning Eastern Standard Time, 7 days a week. I encourage anyone who's on the front lines or has loved ones who are on the front lines to utilize this service. I can't say enough about it. It's really, truly a wonderful example of what can be offered to help people move towards a place of growth during this pandemic. And I'm truly grateful for the women that started this. I think that's it for me. So I think we're taking questions at the end, but that's just my contact info if anyone wants to contact me. But again, I